a vascular biochip, a future approach for a prevention of cardiovascular diseases. So cardiovascular diseases in general, they were admitted that by the World Health Organization that by 2019, 17.9 million people died due to that event, that making up 31% of the global population. And according to the American Heart Association, on average, every 36 seconds, somebody dies due to such event. And by 2035, more than 130 million people are subjected to have some sort of cardiovascular disease, including us. So what is the need? The need is to find an innovative solution, probably an implant, smart implant, such as a biochip in our case, to self-heal and prevent this lipid buildup and fibrous elements buildup and inflammatory cells in the arteries, and as well to decrease this death rate, as well decreasing the symptoms due to this coronary artery disease, such as chest pain, nausea, and then high blood pressure.
So, what is our proposed solution? Our proposed solution is to create a cheaper, minimally invasive, and effective biochip that can continuously monitor the potentially diseased artery and prevent any future complications. So, taking inspiration from previous work that focused on cutting-edge technology in the field, our team designed a special implantable biochip that has two main functions: diagnostic and preventative sides. On the diagnostic side, the chip would use microsensors and biosensors to monitor blood pressure and protein levels specific to cardiovascular diseases such as atherosclerosis. On the preventative side, the chip would use genetically engineered bacteria and other microchip delivery drug systems to understand the levels in the environment and provide the proper dosages for the preventative treatment to maintain the proper functionality. To fabricate the biochip, we would utilize biomem fabrication techniques and genetically engineered bacteria to develop the required microsensors, biosensors, and drug delivery systems. To effectively use the biochip, the implantable biochip would be attached to the inner wall of the artery, potentially diseased artery, and be deployed using a catheter to make it minimally invasive, similar to a stent procedure.
So the biochip is able to diagnose different blood clotting diseases, which makes use of its multi-use, and it works as a doctor, so it cuts down routinely visits to the doctor. Using continuous monitoring and dispersing of medicine throughout the body, we don't wait for the blood clotting levels to get to a certain level before we take action. So the price of one biochip would be $20, which is $10 less than ACE inhibitors, and yearly blood work would be required, which is already the norm. So you're killing two birds with one stone, getting checkup for conditions that might be in the future, and checking on the biochip for biofunctionality and biocompatibility.
So competition, as our approach has both diagnosis and prevention capabilities, we are going to compare both gold standards. So for diagnosis, we have invasive coronary angiography, which it's a really good method to find narrowed arteries. However, it's mainly invasive, and only 25% of the people that get this diagnosed procedure get actual treatment with a stent. The remainder 75% prescription of medication is done to like prevent future buildup. So this prevention is the use of statin, which is a drug that reduces cholesterol about 30% and up to 50%, but only prevents cardiac events in 20% of the cases. Our approach would be adjusted to the amount of, so as you are doing already an angiography, for those 75% of the people that are not getting any treatment, you can just implant this chip right away, and that would monitor future events, as well as release suggested statin or whatever drug we want to the amount of cholesterol present. So if our solution is not implemented, the cost and deaths caused by coronary artery disease will keep increasing, and our biochip will be able to treat and diagnose this even before the patients get a chance to have symptoms, which give doctors time to react appropriately.
Thank you for listening.